This episode is brought to you by Goals.com, the sales performance platform built to help teams stay focused, motivated, and on track. While most CRMs just track data, Goals.com drives real results. It's simple, affordable, and designed to help your sales team hit targets faster, without the headache of complex setup or costly consultants. Whether you're using a CRM or not, Goals.com works seamlessly to elevate your performance. Book a fun, fast demo today at Goals.com.
All right, welcome back to the Goals.com podcast, the show where we uncover what drives sales performance at the highest levels. Today's guest is Ryan Fogarty, Chief Revenue Officer at Scuvent. Ryan has built and led sales teams in both U.S. and international markets. Now at Scuvent, he's helping medical device companies solve one of their toughest challenges, field inventory management. Get ready for a conversation about leadership, innovation, and what it takes to succeed at the fastest-moving world of healthcare sales. Ryan, you've held leadership roles across major healthcare companies like Covidien, Stanley Healthcare, and Securitas. What first drew you into the medical device industry, and what's kept you passionate about it?
The thing that really drew me to medical device was just the message and the overall, just the mission of healthcare sales, right? So it's interesting to be in such a place where you're challenged intellectually every day. Things are changing all the times, but at the same time, you're helping people, right? So it's just that underlying challenge of how do you make healthcare better in the U.S. and then globally, as a matter of fact. And that to me, as well as the challenge mentally to be able to have something new every day was really what drew me to medical device in the first place.
Sure. You've worked in both U.S. and international markets. What are some of the key differences you've seen in how sales teams operate globally?
Man, I'll tell you what, it's a vastly different world, right? Because the rest of the world sees healthcare in a little bit of different light. And so here in the US, we run everything by processes, playbooks. Medical device sales is very regimented quite a bit of the time. When you start applying that to an international market, it doesn't work quite the same because you're dealing with different cultures and different governments and different languages and each little piece operates just a different way, so each sales team has to operate in a different functionality, right? So you can't just paint everything with a broad brush. I always used to joke with my international folks, can you imagine if Texas, Louisiana, Oklahoma were all different countries, and instead of one rep covering them all, you've got a sales team, a marketing team, regulation team in each one of those states. It'd be a whole different game here. And that's the thing, they have to be a lot more nimble and be able to operate with those different constraints versus here. So I always love the international market just because there's so much going on and there's so many different things you have to address and problems that you have to go after, and you do have to be very creative to make sure you can scale and succeed in all those different markets.
Yeah, for sure. Looking back, what's a pivotal moment in your career that shaped how you lead sales organizations today?
Yeah, I'm not sure if it was really one moment, but just seeing how how things progress over time, and seeing what doesn't work, right? So in the past, we were big fans of if we weren't getting the type of sales results we wanted, let's shuffle the deck and do it again, right? And instead of actually giving reps tools that made them better and made them more excited about doing their job, we just kind of changed their job and thought that that would be some of the ways that we could help spur growth was just through change alone instead of the right kind of change. So seeing how that kind of played out over the course of my career a couple of different times, that's one of the things is I try not to address change for the sake of change, but actual meaningful change that makes people better at what they do and makes them more excited to do what they do. And that's what I've seen has gotten the best results.
Yeah. As a CRO, you oversee both revenue growth and operations. How do you balance strategy and execution in such a complex regulated industry?
It's funny getting into this role and being more over the operational side in addition to the sales side. Eh, on the sales side, you really key in on just that and don't think about the other parts of the business, right? But now I see a lot more on just how much of an impact a poor operational plan can have on your sales team, right? So when they have hurdles and when they're seeing things internally, it makes the external job of actually selling that much harder, right? So in my role now, I'm trying to be very cognizant of the operational side of it, and instead of just scaling up quickly on sales without the good base and the good floor operationally to build upon, make sure that those groups and those parts of your company are really well defined and really well run before you start trying to tack sales on top. Because if you keep tacking sales on top of a shaky foundation, it's just going to get shakier. So that's one of the things I've really noticed, that I have to make sure that operational side is very, very well grounded.
What's your approach to building high-performing sales teams in healthcare, an industry where compliance and precision matter as much as results?
Yeah, to me, it's finding the right people, and that's not always finding people with a huge Rolodex, right? Like, I want to find the right people that meet our culture and that fit in and want to grow and want to be challenged and want to learn. So instead of, like I said, just finding people with a bunch of connections, I really want to make sure the people that we hire fit within the way we like to do business, right? So I find that the people that are more inquisitive and the more wanting to learn about our space tend to be the best salespeople, because in the end, knowing your product is kind of the entry ticket into the game, but it's knowing your space that really makes you a high performing player. So that's what I look for in those folks that I try to bring on, are folks that really want to learn about why hospitals do what they do, or now with Scuvent, why people run a company the way they do and what their pain points are, so that they can really actually solve a problem that these folks have. And that's what I think makes more impactful salespeople.
Yeah, I love that. What's the hardest part about leading sales in the medical device space, and how do you overcome it?
Nowadays it seems like, I know people talk about it all the time, but burnout is a huge issue, right? And I think that's the deal, is that we're pushing more and more and more responsibilities and activities and, different types of tools that we want people to use. And I think that just drives them away from doing what they like to do every day, which is sales, right? So I think what I really try to keep in mind is you want to make sure that the process is repeatable and that keeps people excited, because like I said, the burnout piece, especially with sales groups being so fragmented and all over the country, in these remote type roles, it's hard to make sure that they're engaged in doing what they want to do, right? So that's really the thing. And to be honest, hiring the right managers and training those managers is a key thing that I think a lot of people skip out on, because a lot of people will promote best reps into a manager role and expect them just to be a good manager. But you've really got to invest in those people, because that frontline connection to your sales team is what makes all the difference. So really making sure you contribute to their growth, I think, is key to having a successful sales team.
Scuvent focuses on solving field inventory challenges for medical device companies. What's the number one pain point you see companies struggle with when it comes to inventory management?
It's all about visibility, right? So anyone that's got a field inventory management program, or that deals in reimbursements from facilities, if you send a bunch of stuff out and you have no idea where it is, and then the reps all have to kind of connect with each other through text and email, and try to figure out who has what and ship it where, but really when it leaves the warehouse to when you might be able to get a PO and get revenue coming in, there's this void there, right? So that's really what we're trying to address, is that visibility factor, to make a platform that's easy to use so that people can actually see what's in the field and where it is, and then be able to track it. So instead of being just another platform that reps hate to use because it's cumbersome and, this is something they don't want to update, it's got to be a platform and something that they actually get value from updating. So they use it more as a tool than an anchor, So trying to focus in on that visibility is really what we're trying to do.
Yeah. The industry has been slow to modernize in certain areas. How do you position technology like Scubin to companies who may still be using outdated systems?
You know, that's a funny question because the thing you start to realize, and as I look back, as a med device manufacturer, we pitch precision every day, right? So you're trying to sell your product to a doctor, you're trying to change the way that they do their, daily workflow. You're trying to show the value that, hey, if you use our product, it makes X, Y, and Z better. And then all of those companies, when you actually try to reach out to them to do the same in their own business, it's how much does it cost? We don't have the money for that. It's the same problem that they're trying to sell against that they don't want to address. So really that's what we're trying to do is show people that, look, you want to modernize your procedure just like you want your physicians to modernize the way they practice medicine. It's the same thing. And the more you can do that in an effective way, the more profitable your company is because you're operating more efficiently, and the more you can reinvest that money back into your platform to help make it better and keep you ahead of your competitors. So that's really the thing that we key in on is the value of this operational black hole that people don't want to address because it's hard, but it's the same thing that nurses don't want to adopt your new product because it's hard and it's different. It's the same thing. So we're trying to make sure people realize the value that they can have that profitability to reinvest.
That makes sense. What excites you most about the future of technology in healthcare operations and sales enablement?
Like I said, it does go back to that visibility piece. I sold with the Securitas Stanley Black and Decker platform, we sold real time location, right? So we would see hospitals buy millions of dollars worth of infusion pumps and then just let them go out into the wild. It's like, you gave your kid your 16-year-old a Ferrari and just said, "Hey, have at it. I'll see you in a couple weeks." You never see it again. So it's the same thing here. You're shipping out products to all your reps and it's gone, and then maybe it comes back, maybe it doesn't. So seeing the way people can use technology to find these problems that have been there forever, that's really what excites me because there's tons of stuff that we can do operationally that we just haven't. And now with, AI and the way we're looking at things differently, we can use those to address those problems that we've never really been able to impact before.
You've led teams through big transitions, new markets, new technologies, acquisitions. What leadership lessons have you learned about guiding teams through change?
The biggest thing for me that I've seen is clarity. You have to be open, you have to be honest, you have to communicate basically 5 times as much as you think you would want to make sure everyone is on the same page, and why you're doing what you're doing. Because that's the thing is you start getting a bunch of reps and they get apathetical about the change or they're confused, and it's all comes down to the messaging from the top and how that gets down to the management structure and then how it gets down to the reps. And sometimes, skipping that level and just going straight to the reps and making sure that they know what they're doing and why you're doing it makes all the difference. Because the more you have this swirl and the ambiguity that's out there, the more the reps are just kind of floundering and not doing what you need them to do, and you're losing productivity, right? So over communication in times of change, I think, is key. And sometimes you just have to look at yourself as a leader and say, you know, why are we doing what we're doing? I need to make sure everyone knows specifically why we're doing it so that there's no ambiguity and everyone's marching towards the same outcomes.
Talked about burnout earlier. Sales in healthcare can be high pressure and complex, but how do you personally stay motivated and avoid burnout in such a demanding field?
You know, to be honest, you you get to a point where all you're doing is or a lot of what you're doing is forecasting and, HR kind of stuff. So you get away from what you really want to do and really got you into this business in the first place. So for me, if I need to get grounded, that's when I go back out into the field with my sales reps and really kind of try to reconnect with them and with the client. Because I think a lot of times people will get away from the client and then you're not really viewing it in their perspective anymore. And I think that can adjust the way you make change or make choices. But it also gets you less invigorated in what you're doing. So I think taking a step back and really getting close to the client and to your sales reps, I think helps with that burnout because it gets you reinvigorated. You know, a lot of these reps are very motivated. They want to be successful. They have ideas, and getting back in the mix with those guys really helps.
Yeah. What's the best piece of advice you've received from a mentor or colleague that still guides you today?
Yeah, I think it goes back to the whole motion for the sake of motion isn't actually progress, right? So I think you have to be very targeted about what you're trying to do and then direct your efforts into that. But just doing change for the sake of change because it feels like you need to do something isn't really helpful a lot of times, right? It creates a lot of confusion, a lot of swirl, people kind of wondering where you're going at because it seems like you're just throwing darts against the wall. So if something's working and you just have to tweak that thing that's working, that sometimes is okay. You don't need to do an overhaul because it's year 3 of your leadership change and you think that it feels like you have to do something different. I think you just really need to make sure you know where you want to go and then make changes that drive towards that outcome. It was probably the best advice I think I've gotten.
Yeah, I like that. If you were mentoring a young professional just starting out in healthcare sales, what's one skill or mindset would you tell them to develop to set themselves apart?
It goes back to that curiosity thing, right? I think if someone's coming into the business, they've really got to be curious, not just about what the company and what the product that they're working for sells or does. I think you've really got to understand what the market that you're going after, what their pain points are, how they do what they do, which expands way past just your product line, right? You have to understand how your product fits into their workflow and how you can help them. But without knowing what else they do and putting yourselves in their shoes and having that operational empathy, I really don't think you're going to get to that next level, right? So, the best sales teams I've ever had work for me were the folks that have been in the industry for a long time and knew everything about every product that's going into that facility. So, they understand more how their piece fits into the overall puzzle. Because in the end, customers are us. And, you just have to know what they're feeling and what they're doing in order to see how what you're selling to them works.
Makes sense. That's going to be a wrap on today's episode of the Goals.com podcast. A big thank you to Ryan Fogarty for sharing his insights on sales leadership, innovation in healthcare, and building teams that thrive under pressure. If you enjoyed this episode, don't forget to subscribe and share it with someone in your network who's looking to level up on sales. Until next time, stay motivated, stay focused, and keep hitting your sales goals.
This episode is brought to you by Goals.com, the sales performance platform built to help teams stay focused, motivated, and on track. While most CRMs just track data, Goals.com drives real results. It's simple, affordable, and designed to help your sales team hit targets faster, without the headache of complex setup or costly consultants. Whether you're using a CRM or not, Goals.com works seamlessly to elevate your performance. Book a fun, fast demo today at Goals.com.